day, nearly 40,000 people came forward and get tested. And that is really critical at this time. We need everybody with the mildest of symptoms or who's deemed to be a close contact to come forward and get tested. And we're really pleased that that's occurred, nearly 40,000 people. And out of those 40,000 tests, we had 9 that were local transmissions. 8 out of the 9 were all directly linked to the Northern Beaches, to the Avalon cluster. The 9th one could actually be a false positive or an old infection, and so health has not ruled out the possibility that it could actually be a false positive, and obviously that's under investigation, and Dr. Chant will be able to give a bit more detail about that. The other bit of encouragement is that out of those 8 that were directly linked to the Avalon cluster, 6 are household contacts, so 6 out of those 8 actually lived in the same household from someone who had the virus, and that the other 2 are deemed to be close contacts to a venue where the disease was transmitted. Having said that, there are still concerns about the CBD and still concerns about people within the Northern Beaches who may unintentionally have spread the virus without knowing they have it. And for that reason, the next 3 days, so from Monday the 27th of December to the 30th of December at midnight, we're going to revert back to what occurred before Christmas, with one exception. So if you're in the Northern Beaches, in the northern part of the Northern Beaches, you revert back to the stay-at-home provisions, except for the fact that you can have an outside gathering of up to 5 people for recreation or exercise purposes, and that'll be until midnight on the 30th of December. In the southern part of the Northern Beaches, again, we revert back to the stay-at-home provisions, but you can have an outdoor gathering of 10 people for recreation or for exercise reasons, but we don't want any people outside the household coming into households for the next 3 days. What our strategy is to nip this in the bud as soon as we can, to make sure that we do the hard yards now, so that we can have normality as soon as we can. For Greater Sydney, we again revert back to what happened, what was the case on the 23rd of December. So go back to no more than 10 people in your household, and everything else is the same. Again, our strategy is to make sure we nip this in the bud as soon as we can, that we get on top of it as soon as we can, and of course in the next few days we'll let the community know what New Year's Eve looks like for people on the Northern Beaches, but also Greater Sydney, and also what January looks like in the Northern Beaches and for the rest of Sydney. So we want to thank everybody for your cooperation. We were very pleased this morning to see that people listened to our instructions regarding CBD shopping. Thank you to everybody for your cooperation. Those that did turn up were wearing masks, and obviously the number of people was substantially reduced, and we're deeply grateful for that. We know to date that the strategy we have in place is working, and I just want to really thank everybody for trying so hard and working so hard during what is often a time of year when all of us are coming together. So the message strongly is, please maintain the vigilance. Northern Beaches community, thank you for your patience, but we are reverting back to what you experienced on the 23rd of December. So stay-at-home provisions still exist. However, the one exception is in the northern part of the Northern Beaches, you can have an outside gathering of 5, and in the southern part, you can have an outside gathering of 10. But I want to stress again, this means no movement to people inside the Northern Beaches. If you're in Greater Sydney, do not go to the Northern Beaches. If you're in the northern part of the Northern Beaches, do not go unless you absolutely have to outside of your zone. And similarly, if you're in the southern part of the Northern Beaches, don't go outside of your zone unless you absolutely have to. All of us in Greater Sydney should be reducing our activity where possible, not undertaking activity unless we absolutely have to. And of course, the restrictions or the lack of thereof in regional New South Wales are the same. So regional New South Wales doesn't change at all. Again, a big thanks to everybody. We are making good inroads, but we want to make sure we get on top of this in as shortest time as possible. And we will let the community know in the next couple of days what New Year's Eve looks like, and then obviously what the first couple of weeks of January look like. I'll now ask Dr. Chant to provide her daily update. Minister Hazzard will make some comments, and then we'll take your questions. Thank you.
So New South Wales recorded 9 new locally acquired cases of COVID in 24 hours to 8 p.m. 8 were linked to the Avalon cluster, 6 being household contacts, and 1 additional case related to the Alimentary in Paddington, and 1 relating to the Avalon Bowling Club. This again highlights the importance of that full 14 days of vigilance for the close contacts, and I extend my appreciation to all of those people who spent their Christmas day in isolation for the sake of protecting their loved ones and also the broader community. There were 6 new cases were acquired overseas, bringing the total number of cases in New South Wales to 4,658. There was 39,133 tests performed in the 24 hours. Now that's dropped down from a height of 69,000, but that exceeded my expectations. So again, thank you to those people who presented for testing in that period. And maintaining the high testing rates is going to be essential to give us the best information to advise government on the next steps. So please, with the mildest of symptoms anywhere in the state, please present for testing. Also, just in terms of an update on the venues and cases of note, there was a case in a young child who ate at the Paddington Alimentary restaurant, announced yesterday, and it has been included in today's numbers. So there are 4 cases associated with this venue. So all diners, again, are reminded from December 17th to the 19th, they need to remain in isolation and get tested if symptoms arise, even if they've had an earlier negative test. It's essential, if symptoms arise, to get retested. And takeaway customers need to get tested should the slightest symptoms develop. This is a venue that we've seen for transmission events, and so we need to be very vigilant as a community. In terms of the Bondi case under investigation, a case reported today as locally acquired and under investigation is that of a person in the Bondi area with no known links to the Avalon cluster yet. The case remains under investigation. We're relying on serological testing and repeat testing on that case is negative, but we are looking at whether that could be a false positive or an old case. But all the public health action is occurring regardless, as we take a very precautionary approach to these notifications. In relation to the flight from Sydney to Griffith, so a person who flew from Sydney to Griffith on Monday the 21st of December has since been confirmed as positive for COVID-19. The person flew before they knew they were a close contact of a case and did nothing wrong. But we are alerting passengers on that Rex flight that departed Sydney to Griffith on Monday the 21st of December. There were 28 passengers and 1 flight attendant on the flight, which left Sydney at 2:10 p.m. and arrived at 4:20 p.m. in Griffith. They are considered close contacts and must self-isolate for 14 days. And anyone who has symptoms should get tested immediately, and testing is available at Griffith-based hospital. In relation to the Boxing Day, can I say that from looking at the preliminary information we're getting on the community's response to Boxing Day, I'm incredibly pleased with that response. But again, it's vital, as we're in this critical phase of the response, that people limit non-essential movements, avoid crowded spaces, and if they do need to go shopping and out and about indoors, please wear a mask at all times. Thank you.
Well, as a fellow Northern Beaches resident, I'd just like to thank the people of the Northern Beaches for their incredible response to the government's requests. Certainly the majority of people on the Northern Beaches have been sticking in either their northern zone or their southern zone. I would say this, though, that I would implore people, as we go back to the rules that applied previously, it is really crucial that you follow the instructions. Residents of the northern zone, obviously there are higher risk factors that we're concerned about in that northern zone, so north of Narrabeen Bridge, and I am imploring you to stay in the northern zone. Those in the southern zone, the risk factors are still there but not quite as high, and so again I am imploring you to not travel outside the Northern Beaches unless it is absolutely critical. Now there are obviously reasons, legal reasons why you can, but you needn't actually adhere to those either, in the sense that you should stay in the southern zone. Just because you have an excuse to leave doesn't mean you should. So basically stay there. Stay in the southern zone, stay in the northern zone. If you are out necessarily moving about, it's absolutely critical for us in that whole Northern Beaches area, as well as broader Sydney and indeed New South Wales, to continue to wear a mask whenever you're out and about near other people, and also to maintain that 1.5 metres social distancing. Make sure you stick with the hand hygiene, and of course if you have any symptoms of a flu or cold-like illness, get along and get tested. Those tried and true measures are what is keeping us as safe as we are. Obviously, with the increased risks at the present time, we need to really focus on those tried and true measures. I want to say something about what I saw yesterday, the vision on Bronte. People on the Northern Beaches have been doing their part big time to keep not only themselves but the rest of Sydney safe. It is absolutely appalling to see what was clearly a group of people, a large gathering of people who didn't give a damn about the rest of Sydney. Let me tell you, that event, I'm hoping, will not become a super spreader event, but there's every chance that it could be. Obviously, in the earlier stages of this COVID pandemic, we had some challenges with backpackers who clearly wanted to party in parts of the eastern suburbs. It can't go on. There is still a major risk for us with COVID, and my message to those people and to anybody that knows any of those people is tell them to just stop it, cut it out, or you may well end up with the virus yourself, or you may end up being part of a super spreader event. It is absolutely appalling. Again, to the broader community, thank you. The broader New South Wales community, I think actually we've been like Team New South Wales. The broader community have done an incredible job to get us where we've got to, keeping ourselves away as far as is possible from spreading COVID or getting COVID, but also being prepared to make sure that our community continues as closely as possible to normal. So thank you to the broader New South Wales community.
Can you just clarify the rules coming into effect midnight tonight? Is that right?
Yeah.
So the new rules will kick in tonight at 12:01 a.m. so people can still have the same arrangements as they've had for Christmas Eve, Christmas Day today. But again, exercise caution. If you are having any sort of friends around your house, it still is far better if it's outside. If it's on a balcony or out in your garden, just try and be safe till tonight. But tomorrow we are moving away from that broader Christmas spirit issue and moving back into what we know is really necessary to keep us all safe. Sorry, Charlotte. Sorry, then you.
Just to clarify, the scenes we saw yesterday in Bronte, apparently a lot of them are backpackers as well this time. What control does the government have over deporting people who are breaching a public health order?
Look, those are issues for the federal government, and we're not wanting to over-respond, but we are asking them to realise, bring some common sense into your everyday activities. Many of those backpackers have come here to Australia and are enjoying the relative freedoms that we have here compared to some of those European countries that they mostly come from and some from the States. If they were in Europe right now, in most parts, they would be locked down and not even outside their front door. So the fact that you can go out is a privilege, and it should be respected in an appropriate way, listening to the government's requirements.
Dr. Chant, a question for you, please. We have heard a number of times in the past week or so people who, where you can't trace it back to the Avalon cluster. Are you having any resistance, as we saw in the early stages of the pandemic, from people who want to protect their own privacy, are not willing to give you their movements?
Look, I would like to say thank you to the vast majority of people that have been very open, honest and forthcoming with contact details. We have, in the general main, had incredible community support and response. So I wouldn't like to characterise it. I'd just like to reassure people that when we are asking you for the information around who you've been with and the close contacts, health keeps that incredibly private, and I think that I've argued very strongly in many media occasions about why we're not giving you out more information. So I would again like to reassure people that we will hold any information we gather in the process of contact tracing with the utmost of privacy, and so feel safe about disclosing everything. It is so critical that people have that confidence in public health officials.
I infer from your answer, though, because I understand from your position of responsibility, you don't want people to feel as if they're going to get in trouble for some reason, or the media is going to send out a lynch party. But is it a reality that people are still not giving you that information, despite your assurances that they are utterly private?
Oh, look, there are very occasional exceptions to that. But really, I've just been overwhelmed by the support and the response from cases that we've been recently engaged with.
Dr. Chant, is there any update in relation to the Belrose case and the genomic sequencing testing? Do you believe that could be linked to the very early stages of this Avalon cluster?
So in relation to the Belrose case, yesterday we called out for people upstream of that case to come forward for testing. So we've done a lot of downstream testing of that around that young gentleman and found no evidence that he transmitted. But what we were looking for in our call out yesterday was what we call upstream testing, to look at whether we can find anyone who'd potentially been a source for him, and hence I'd said anyone who'd been at that Belrose Hotel in that preceding period of time, please come forward for testing. Even if your symptoms had resolved now, we may be able to still detect some virus in you, even though you're not infectious. And that was why we were also calling out for residents in that community more broadly, just in case there were missing chains established. Given we didn't know where that young man had acquired his infection, for precaution, we need to do a big ring fence around that community.
Freddie, can I ask on the Griffith infection, how concerned are you about the potential spread, given there were 28 people on that flight and most of them got contacted late last night, and there's been a Christmas in between the infection and now?
Well, the one assurance I want to give the community is that health always takes a very precautionary response, and we make sure as soon as we have any inkling of information on potential close contacts, we get that out there. Dr. Chant's better able to answer the question on the specific risk of that flight. But generally speaking, we'd rather be cautionary and put the information up there and then be able to say that we're not as concerned as we were. But I'll ask Dr. Chant to give a more scientific update.
So as I indicated, there were 28 passengers and one flight attendant on that flight. Our usual processes will be testing those individuals, and so I'll be able to update on any risk assessment, and then those individuals will be required to go into 14 days isolation. If they're all negative at initial testing, then it means that there's no risk of further transmission, and that's why we've traditionally asked people to get a test, then self-isolate, and then represent if they've got any symptoms that emerge in that 14-day isolation period.
My understanding of the circumstance there, though, is that testing wasn't available last night unless you had symptoms, and only from midday to day.
Look, I would actually be following up, but that's not our usual process. We do asymptomatic testing. Yes, it's across the state for close contacts. We will follow up that piece, but we have definitely, our process is, if you have been identified by public health as needing testing, you are permitted to have asymptomatic testing. The reason we don't want asymptomatic more broadly is that is the lowest yield for us at this critical point, and then it overwhelms finding those cases we want to find. But we have also communicated with the Commonwealth, and I've got to say they've also communicated that to the GP clinics around the state as well, that we are permitted to do asymptomatic testing.
Can I ask quickly about New Year's? Are you concerned about community transmission coming up to New Year's?
I think we're closely monitoring the situation. What we're focused on is getting the best information we can provide to government on the risk of any community transmission. The fundamental steps we're putting in place to reduce mobility of the people in the Northern Beaches area and the northern zone and the southern zone is to stomp out any community transmission and risk. Now, we'll continue to monitor that. Situation changes. I'll get a briefing immediately after this press conference. But what we're looking at particularly is increased in cases that are not linked to the cluster. And what I would be hoping is every day I'm announcing that new cases have been isolating for their full infectious period. So we are expecting to report additional household contacts, and that's what we see because people have infected the household before we've managed to get to them. We see that long tail, but what we're hoping is that everyone has, from here forth, has been in isolation increasingly for that whole 48 hours before we've tested them and found them as positive.
Dr. Chant. In terms of the strategy, I understand, I mean, you're working progressively as the entire year has gone by and dealing with each scenario as it's presented to you. In this case, 28 people and flight attendants going to Griffith. Why is it that close contacts of those people I might also ask to self-isolate. Is that thought to be overkill? Because it seems to me a Rex flight is a very confined space, a lot of commonality of touching surfaces. There's a fair chance there's somebody there who will have lots of...
So what we do is we assess each of those, and if anyone has got an at-risk contact, such as in an aged care facility, disability home, then we would, as a precaution, say for those close contacts to be in isolation until we've got a negative on the original contact. The reason at this point, just because of the venue size, that's considered the most effective strategy for us at this point in time. But we will take a very conservative approach, and I'll be able to brief you later on. We'll be giving obviously an update on that flight in terms of the results for people.
If people were unable to be tested last night in Griffith, what risk does that pose to the community, and why is that great?
Look, at this point in time, I haven't been briefed about any issue of access to...
If that happened, what's the cost?
Well, obviously what we want to do is just make sure we get the great people effectively isolating, because that stops any ongoing risk, and we want to assess their status, and that gives us the best intelligence. So I will pursue that after this press conference in terms of the testing levels around.
On the Belrose cluster, just to clarify or infer from your response, you've asked people to come forward upstream, but you haven't yet found anything from that?
That's correct. So we are asking people to get tested, and that is to assure ourselves that there isn't any ongoing transmission in the vicinity of Belrose, Davidson and that broader area in the Northern Beaches local government area. But we haven't to date picked up any other cases linked to that Belrose notification.
So how many mystery cases are there at the moment? There's that man and there's the patient.
So the mystery cases to date relate to obviously the person I announced today, which was the Bondi gentleman. We're still trying to come to a view about the diagnosis, whether that's an older infection or a false positive. We've also got a gentleman who lives outside the area who, though, works in the Manly area, and what we're doing at the moment is just cross-checking the people who he works with, just to check that they're not on our contact. We're also looking at the bus trips that person took into the Northern Beaches to see if there's any overlap. Repeat testing on that gentleman also raises some issues about the timing of the infection, so we're just working through those. And then the other person that has not been linked is a person who acquired the infection in the CBD area, and I think I've indicated to you that he worked in that area of the CBD where there were other infectious cases. We have had 3 cases linked to the CBD, and we've also indicated the Paragon Hotel transmission events. For that person, we have not found an exact crossover point, but we know he was in the vicinity of other infectious cases.
Just to bring on, is there any move on finding patient zero? Sorry, just the other part of the question was about patient zero, whether there's any developments there or if that's counted in mystery cases.
No, patient zero still is, we still do not know the cause of the seeding event in the Northern Beaches. Obviously, the young man from Belrose appears to be a fairly early case from our serological estimates of when he had infection. We're doing that upstream testing. We will advise you if we find any other further links, but at the moment it still remains unclear.
Just a question on private testing. Are you aware of any delays, particularly in the inner west, of people getting the results through private testing providers? We've just had a few people contact us and we're waiting up to 3 days. Are you aware of anything?
Look, I'm happy to follow up with the private pathology providers. I'd like to just thank the cooperation of our private pathology providers, but happy to follow that, to follow up any delays in relation to testing.
Yesterday you asked if people should stay away from the city today. Obviously, the lure of Boxing Day sales is something. So, 2 facets to the question. Firstly, generically, people staying away from the city, and also specifically staying away from Boxing Day sales. I mean, you must be extremely happy with that in conjunction with so many people getting up their Christmas Day to get tested?
Oh, look, I'm so pleased with the response from the community, but we also appreciate the pressure this builds on businesses, and I want to thank the retailers for working with us and for being so understanding. We understand from them that online sales have gone through the roof today, but we also appreciate and understand that some suburban shopping centres are actually busier than what they'd anticipated. So if you are in the suburbs, please make sure you're wearing a mask if you're shopping indoors. Please make sure if it's too crowded, turn around and go home. And thank you to everybody who ordinarily would have gone to the CBD. The response to date has been really positive and overwhelming. Those that have gone into the CBD to shop have worn a mask, and we've seen numbers substantially reduced on last year, which is exactly what we wanted to see. And I do want to thank the retailers for their understanding. Today, is obviously a very difficult day for them to have to hear the state's premier ask people not to shop in the CBD on what would ordinarily be one of their busiest days. So I want to thank them for their understanding, but also thank the public for the response. This is exactly why Team New South Wales is doing well. All of us are working together, making sacrifices so that all of us can be safe, and I really appreciate it. And in particular, those thousands of people in isolation who weren't able to have any Christmas at all. Thank you to you for doing the right thing, and thank you to everybody throughout New South Wales for listening to the advice provided and for being so great at understanding the situation we're all in.
Premier, how hopeful are you about that bill?
Well, look, I rely on the expert health advice, and the health advice is still going through all the motions of what they may assume might be the link to the Avalon cluster. And I think every day that goes by, we get more informed about facts and the genomic sequencing, and that's exactly what the experts are doing. They've been working through Christmas, and I deeply appreciate that. The pathology labs have been amazing to get test results for so many people in a short amount of time. Both government and non-government has been really pleasing, and I want to thank everybody involved in the system. And many people, either through work, through being frontline staff, or through the disease itself, haven't had the normal Christmas period we'd have, and I just want to thank everybody for their efforts.
Just quickly,
Sorry, yep.
New Year's Eve, the big calls to expand the yellow zone, obviously areas like Birch Grove, Port Clues. If the fireworks are going to go ahead, those areas will obviously attract people. They're not in the yellow zone at the moment. Would you consider toughening restrictions around New Year's?
Well,
Are we going to see fireworks?
Well, as I foreshadowed in my opening remarks, we'll be taking health advice in the next few days as to what New Year's Eve looks like, but there are some basic things that I can communicate very strongly today. That is, everybody should assume they're watching the fireworks from home this year. In relation to hospitality venues, everybody should assume the 4 square metre rule as opposed to the 2 square metre rule. And in relation to other outdoor events where we had proposed that frontline workers would be able to go to certain venues, that will be obviously reviewed in the next few days, and the health experts will give us the best advice on how to proceed. But we know for a fact that the vast majority of us will be watching the 7-minute display from home. Those that do have permits in relation to hospitality venues should assume the 4 square metre rule, not the 2 square metre rule, and outside of that, we'll await the health advice.
And what about regional New South Wales? Obviously, there's a lot of hospitality venues in regional New South Wales are pretty happy, but I think we can have a bigger New Year's Eve compared to the city.
Yeah.
What would you say to regional?
At this stage, there's nothing to cause the government to change arrangements in regional New South Wales, but that's obviously based on the health advice, and it's an evolving situation. But certainly, at this stage, I can't foreshadow any difference to what would occur in regional New South Wales. But obviously, in relation to Greater Sydney and the Northern Beaches, it's an evolving situation. And the reason why we're doing it at the moment in 3-day bite-sized chunks is to make sure that we have the best advice available. We don't want to spend a single day or a single hour imposing anything on the community unless we have to. And that's why we're doing things the way we are. We appreciate the time of year it is. We appreciate people have had a really tough year. So what we're trying to do is make sure we manage the disease, we get on top of it, but also that we don't have to impose anything a day longer than we have to. And that's why we want to assess everything in the next few days and then communicate what exactly will be happening in New Year's Eve, and also for the next couple of weeks for people in the Northern Beaches, Greater Sydney and all of New South Wales.
Premier, how was your Christmas Day in terms of did you visit your parents, and if so, what precautions did you need to take?
Oh, certainly. Look, I was able to visit my parents yesterday, which was wonderful, but I've not hugged them since February, so I'm being extra cautious. They're both in their 80s, so we maintained our social distancing and had some...
Just quickly,
yeah.
Bronte Beach yesterday, your reaction to the scenes there, and as a toast with the right did do the right thing. We did see some people partying on the beach, and are you worried that we might see a repeat of that, say, on New Year's Day or some of those other holidays?
Well, look, yeah, the Minister Hazzard was very articulate when he said any event like that gives us enormous cause for concern because it could become a super spreader. It only takes one or two people in a crowd that size to spread it to all, hundreds of people potentially. And so those events, of course, concern us. And of course, we need to consider our options moving forward. We don't want to see that again, especially given people on the northern beaches, the vast majority of the population in New South Wales, I'd say at least, over 90% of people are doing absolutely the right thing, and we're so grateful for that. Everybody's making sacrifices. A small proportion of people that aren't can ruin it for everybody else. And we have to say, as Minister Hazzard said, that we monitor those activities and those events. And if we need to take action, we will. We don't want to go down that path, but we do want to send a strong warning to the community that if enough people don't do the right thing in those circumstances, government has to consider its options.
Well, in terms of outside events,
I'll have to get advice from the police on that.
Everyone's going on holidays at the moment. A lot of people wait till Christmas Day and they go on holidays. How worried are you about Sydney-siders seeding the virus in regional New South Wales?
Well, obviously, Northern Beaches people aren't allowed to move outside of their region, and we've also said to the community, please limit your activity, please make sure you get tested with the mildest of symptoms, please make sure if you're a casual contact, you've taken the health advice, if you're a close contact, you've taken the health advice in relation to testing and staying at home. So we're asking everybody to be responsible, we're asking everybody to reduce their activity, and I think by now, having experienced the pandemic for nearly a year, or close to a year, that people in New South Wales are in the main doing the right thing. So we don't feel we need to make any adjustments there except for saying, please limit your activity, don't move around unless you absolutely have to. And if you do have to move around, please be conscious of every single step you're taking. If you're going shopping, wear a mask. If you're an indoor place of worship, if you're in an indoor setting, please wear a mask. If you're in a situation where there's no social distancing or little social distancing, please wear a mask. But a mask is only the fourth line of defence. Social distancing, good hand hygiene, and also being aware of high-risk areas is obviously the things that people need to do. And we'll just ask everybody to follow the health advice.
Does going on holidays count as essential?
I'm sorry?
Does going on holidays count as essential?
No. Dr. Chant, do you want to?
Yeah. You want to elaborate on that?
I couldn't be clearer. No one from the Northern Beaches going on holidays is not one of the 4 essential reasons for leaving the Northern Beaches. And also to be clear that in the orders, if you have left the Northern Beaches after the 10th or 11th, remember the same conditions apply to you, that you are not permitted you have a stay at home. So again, people who are in the regions who left before they were aware of this, who have departed, they have to stay in the stay-at-home requirements for 14 days since they left the Northern Beaches. And I would urge anyone to have a very low threshold. Any symptoms, if you've been in that northern region area, if you have any symptoms, please get tested. But they have to remain at home and can only leave home for those essential reasons, which is seeking health care, for exercise, they are all, and work, but they are where working from home is not practical, and they may also not gather outside in more than 2 people.
Dr. Chant, one quick one on that flight to Griffith. Are the aircrew now in isolation, and does that 28 number, does that include the hostesses that you have in the pilots? Are they all in isolation?
I think what we were saying is there was one flight attendant who flew, and the flight attendant and the 28 passengers are all considered close contacts and are self-isolating.
Apologies today, I did question with the rest of Sydney, so Greater Sydney.
Oh, sorry.
That's
sorry.
I'm sorry. That's okay. It seems that we're saying that limit your activity, but we're not banning you from going on holidays.
That's right. But if what we are saying is where your travel is not essential, where you weren't had any plans, specific plans, please consider that. But we were also asking people to be particularly COVID safe for this period of time. Limit their interactions, limit large gatherings, particularly indoor gatherings. Enjoy the beautiful weather we're having, which is not too hot at the moment. And please enjoy outdoor environments. They're much safer from the transmission risk of COVID.
One question, Dr. Chant, please, just the 9th person and any other person for whom you cannot trace back to the Avalon cluster or anywhere else, have any of those individuals deliberately been not forthcoming with their details for the sake of their own privacy, or is it just a scientific anomaly?
No, not at all. Those individuals have been incredibly cooperative. So the cases I identified in more detail just earlier in my response, incredibly cooperative. And can I just thank people for taking calls? I mean, the first interview with our case contact tracers can take 2 hours. And then over the period of the next 24 to 48 hours, we might ring those cases 3, 4, 5 and even more times. We're asking them to go through their records on statements where it's not clear-cut. We're asking them to give us their Opal card details, and Transport for New South Wales is helping us look at when they tapped on, tapped off, or train routes. So I just would like to just extend my appreciation for those individuals. I think many of us know how hard it is regaling where you've been in the 14 days before and where you've been when you're infectious, and I just really appreciate the cooperation of those individuals.
Thank you. Thanks, everybody. Thank you.